Hello, let's go over vancomycin together. Vancomycin belongs to the class of glycopeptide antibiotic. The generic name is vancomycin and the brand name is Vancomycin. Now let's talk about the mechanism of action. Vancomycin is bactericidal. Its goal is to kill bacteria or any existing infection, whether it is aerobic or anaerobic. Vancomycin is used to treat infections caused by bacteria. It works by killing bacteria or preventing their growth. Vancomycin will not work for cold, flu, or other virus infection. Indications for use. Vancomycin is a strong antibiotic that is often used for the treatment of serious infection and active against most gram-positive bacilli, including almost all Staphylococcus aureus and Staphylococci strains that are resistant to penicillins and cephalosporins. Vancomycin is for the treatment of Clostridium difficile, also known as C.Diff, MRSA, infections of the bones and skin. Note, it is very important to know that oral vancomycin is only effective to treat C.Diff as it has low systemic absorption. The side effects of vancomycin is the vancomycin flushing syndrome, also known as red man syndrome. This occurs when IV vancomycin infusion is given rapidly. You should stop the infusion immediately. Symptoms include pruritus, flushing, red rash to the face, neck, and upper torso, which may involve the extremities. Monitor for signs of ototoxicity, which manifest as tinnitus, hearing loss, dizziness, or vertigo. Therapy can result in acute kidney injury, including acute renal failure, which is manifested by increasing blood urea nitrogen, BUN, and serum creatinine. You can watch my video on lab review for nurses and nursing students. Vancomycin can also cause hypotension. Vancomycin can be given via IV or oral form. For IV administration, it comes in a powder form which has to be reconstituted with fluid before administering. Remember that you should infuse IV dosage over 60 minutes and if greater than 1 gram, infuse for over 100 minutes. Also note, oral vancomycin can only be used for the treatment of C. diff. When administering vancomycin, let it infuse slowly for over 60 minutes. Monitor blood pressure. Monitor the peak level and the trough. Monitor the patient's IV sites for Thrombophlebitis, which is inflammation of the vein, and Extravasation, which is the leaking of the medication into the surrounding tissue. Vancomycin level is used to optimize the dosing to help prevent bacterial resistance, improve patient outcomes, and avoid drug toxicity. Let's talk about peak level and trough. Every institution have a way they do it, but they have the same idea. Once a patient is started on an initial dose, you want to monitor the patient right after because we want to prevent any renal toxicity from the medication. So the trough level is looked at. Trough level is simply the lowest level of blood concentration of the medication right before the next dose. As soon as the first dose is given, the amount of vancomycin increases in the blood. Trough is taken 30 minutes to 1 hour before the fourth dose is administered. You want to be sure the medication is at the right state and you have to give the dose after the trough is drawn. But in some cases, they might want to hold on to know the trough level, if it will increase the chance of the patient developing renal toxicity or any other concern. Trough can be taken earlier if the patient has unstable renal function. Those should be adjusted depending on the level. It is important to know that vancomycin trough must be drawn before administration of the next dose. The peak level should be 20 to 40 and the trough level should be 5 to 15. Make sure you report a trough that is greater than 20. There are key points I want you to note. Vancomycin is used to treat infections that are unresponsive to other antibiotics, including MRSA and Clostridium difficile. Treatment of C. diff is only effective with oral vancomycin, not intravenously. infuse vancomycin over at least 60 minutes. For dosage over 1 gram, infuse at least 100 minutes. Monitor the peak and trough. Always remember to draw trough prior administering the next dose. Stop the infusion if red man syndrome occurs. I hope you like this video. Kindly like, share, and subscribe, and follow for more. Thank you.